When men experience depression, many times they'll exhibit it by either withdrawing and isolating and not wanting to socialize, or they will act angry or grumpy. Men are allowed to experience bad feelings through anger, but it's not as open in society for them to say that they're feeling sad or they're feeling badly about something. But they can express grumpiness and anger more readily. It's more accepted in our society. So you'll find men, when they're feeling depression, tend to go into some form of action, and the action that they go into is anger, or hiding themselves away at work and becoming workaholics, or isolating themselves from other people. Women have been taught to take care of other people before themselves. And one of the drawbacks for them with this is that even though they may be feeling clinical depression, and even though they may be able to identify what the feeling is, they will dismiss their feelings ahead of helping somebody else. So they will not go for treatment themselves because they've been taught, I need to take care of other people first, to put themselves second. And that way they find themselves not in the system also with getting treatment for depression. Another hurdle that women have to get over to getting themselves into treatment is they tend to internalize. They internalize problems, and that means that they blame themselves. They feel that, oh, they're feeling this depression or they're feeling this sadness because of something they've done. Maybe they're a bad person or whatever they're thinking, but they think that they are responsible for the feeling, and so they tend not to go out for treatment because they think they can just handle it themselves. It's something in them. Women will also focus on the negative. There's a tendency when they're feeling badly to focus on the negative and to take that as a vortex down. And part of the baggage that goes with that is the feeling that no one can help me, therapy isn't going to help, so I'm not going to go seek that assistance. It's just a waste of time for me. And it carries them down. Now, if they're in a stronger social structure and they're talking to other women, sometimes they can be helpful in getting them into some kind of treatment and dealing with this clinical aspect of depression. But men won't do this. Men tend not to do this. Men will tend to want to do it on their own, and they will resist the idea of going to somebody else for help because it affects their sense of pride, their sense of self. A man doesn't seek help from anyone else. You know, he's able to do it on his own. So it's more difficult to get them into therapy when they really do need the treatment. Two of the most common forms of depression I'm actually going to talk about are major depression and dysthymia. Dysthymia is a milder form of depression. It's pervasive, it's chronic that a person feels, and it's diagnosed by an occurrence that takes place over at least a 2-year period of feeling a sense of sadness or a generalized sense of depression. And then it's characterized by several other aspects, which would be loss of appetite, fatigue, loss of sleep, and some insomnia, or hypersomnia, which means sleeping longer than usual. A loss of pleasure and joy in life. But this happens on a very low level, it's chronic, and the person just never seems to quite feel like they can get out of this. Now, major depression, on the other hand, is a sudden change in the personality. And it's over 2 weeks. So with major depression, you have to have experience of a more severe feeling of hopelessness and depression over a 2-week period. And when you have that, then there are some other issues that come along with it. All the same ones that you have with dysthymia, except they're more severe, they're more pronounced. And then you'll have feelings of worthlessness, and you'll have suicidal ideation in there as well. And it's a real sudden change in the individual's functioning. Dysthymia is a part of the character of the individual. In dysthymia, you might meet this individual and know them for years, and you just figure that's just who they are, that's how they behave. But they really are functioning on a lower level, and they're feeling a sense of depression. It's part of their character, it's part of the background. With major depression, you notice a severe change in that person's personality. And they're distinguished by the severity and the duration. The duration of major depression tends to be shorter lived, but much more severe. Dysthymia is a long-term, sometimes it's a lifetime experience. It's not as severe, but it is debilitating on its own right. For more information on depression, you can go onto my website at LAtherapist.com, and for self-help, you can check out my other website, which is hypnocd.com. I'm happy to answer any questions that you have.